secondary illness, loss of responsiveness, and CPR. Topics to be covered. Topics to be covered in this module. What to do when the patient is unresponsive and breathing. Adult. Baby, less than 1 year old. Child, from 1 year old to puberty. What to do when the patient is unresponsive and not breathing. Adult. Baby, less than 1 year old. Child, from 1 year old to puberty. What to do when the patient is unresponsive and breathing. Adult. Unresponsiveness from a casualty is an indeterminate state that can last for just a few seconds or much longer. It can be a brief fainting spell or a much more serious condition. The causes can be anything from head injuries, exposure to heat or cold, or alcohol poisoning. When dealing with an adult who is unresponsive but still seems to be breathing normally, a first aider will need to consider the following steps. Gently shake them by the shoulder or call them to see if it is a temporary state you can rouse them from. If they remain unresponsive, keep their airway open by placing one hand on the casualty's forehead and gently tilting their head back. When the mouth naturally falls open, put your fingers on the chin and lift it slightly. What to do when the patient is unresponsive and breathing. Check for normal breathing in this position. Look at the chest moving, any unusual sounds from the throat, and expelled breath from the mouth. Monitor for approximately 10 seconds in this state. If they continue to breathe unassisted, put their body in the recovery position. It will allow them to continue breathing easily. This is especially urgent if they are lying on their back or front. If there is a possibility of spinal injury, do not move the casualty into the recovery position. Instead, keep the neck and head still and gently open the jaw with your fingertips to allow unobstructed breathing. Once they are safely breathing without aid, call the emergency services immediately. Baby, less than 1 year old. If a baby aged 1 year or less becomes unresponsive but still seems to be breathing, a first aider can take these steps. Gently flick or tap their feet to see if they respond to the sensation. If he or she does not respond quickly or rouse, check their breathing. If the casualty has a heart or breathing condition, phone emergency services immediately. Keep their airway open by putting a hand gently on the forehead, tilting the head back, and keeping a fingertip on the chin. Check for normal breathing. Again, look for chest movement, throat noises, and breath being expelled for 10 seconds max. If breathing without assistance, hold the baby in an adapted recovery position, cradling them in your arms, keeping their head tilted slightly downwards to promote easy breathing and prevent choking. Call emergency services as you continue to monitor the baby. Child, from 1 year old to puberty. If a child is not responding to you, tap them on the shoulder and ask them to speak to you. If they do not reply and show no signs of consciousness, they are most likely to be unresponsive. If they are unresponsive but still breathing, a first aider will need to keep their airway open by gently placing a hand on the child's forehead and tilting their head back. As their mouth drops open, lift the chin with your fingertips. Ensure the casualty continues to breathe normally by performing the usual checks on chest movement, expelled breath, and throat noises. Monitor for 10 seconds. Child from 1 year old to puberty. If they continue to breathe normally, put them into the recovery position on their side. As with an adult, it is important not to leave them lying on their back or front. If a spinal injury is suspected, keep the head and neck immobilized and contact emergency services. What to do when the patient is unresponsive and not breathing. Adult. If a first aider locates a collapsed adult, performs an assessment, and finds the patient to be unresponsive and not breathing normally, you will need to perform CPR and arrange for emergency services to be called. Then these crucial steps should be taken. If you are alone, shout for help. If no one is around, use the speaker function on a phone and start the CPR whilst talking to a 999 operator. Never leave the casualty alone at this time, even if a defibrillator is signposted nearby. Get someone to bring it to you or wait for one to arrive with an ambulance. Perform CPR. Kneel next to the patient, start chest compressions and recovery breaths. Repeat the compressions at a steady rate of 100 to 120 compressions a minute. Keep a rhythmic pace. Internally, time it to a favorite song if it helps. As inappropriate as it may seem, it could be life-saving. After every 30 compressions, give 2 rescue breaths straight to the casualty's mouth. Please note, if you are not fully trained in CPR, just give the chest compressions. If the chest does not rise, make sure the airway is clear until emergency services are on site. Use a defibrillator if one becomes available and you are trained. If the patient recovers consciousness or starts to breathe normally, continue to monitor their condition until medical professionals arrive. Baby, less than 1 year old. As with previous guidelines, a first aider will need to check to see if the baby is responsive by gently stimulating the feet. If they do not respond to you and you believe they are not breathing correctly, CPR will need to be performed. Follow these steps to deal with the emergency. Alert anyone in the vicinity for assistance and call emergency services. If you are alone, you will need to perform CPR for at least a minute before calling 999, so circulation does not immediately cease in the casualty. Place the casualty at roughly waist height on their back on a steady surface. Give rescue breaths to the patient by clearing their airway, sealing the lips around the baby's mouth, and blowing gently until the chest rises. Repeat this a further 4 times, 5 in total. Follow this with 30 chest compressions. Place 2 fingertips on the baby's chest and gently press down on the breastbone by a third of the depth of the chest. Release the pressure, but don't remove the 2 fingers completely. Allow the chest to rise naturally. This is 1 compression, so repeat a further 29 times with 2 compressions per second. Give 2 more rescue breaths. Carry on with this procedure until emergency services arrive or the baby starts to respond and breathe on their own. If they continue to breathe, cradle them into a recovery position until medical professionals arrive. Child from 1 year old to puberty. As with previous procedures, a first aider should check a child for unresponsiveness and unrestricted breathing. If breathing is occurring, then CPR should be performed and the following steps should be taken. Kneel by the child as they lie flat on the floor, roughly level with their chest area. Ensure the airways are clear. Pinch the nose and breathe steadily into their mouth, noting when the chest rises. Allow the chest to fall and repeat 4 more rescue breaths. Follow up with 30 chest compressions with the heel of a hand placed near the end of the breastbone and the center of the chest. Press down firmly by about 1/3 of the chest depth. Allow the chest to rise without removing your hand. Press down again and repeat 29 more times. Follow up with 2 more rescue breaths. Continue this until emergency services arrive or the child recovers. If you remain alone, call 999 after a minute of CPR. Summary. What have we learned? There are 3 different age classifications when treating a collapsed casualty, and each should be treated differently. There are different ways to check for responsiveness in adults and children. There are specific ways to perform CPR and adopt the recovery position for a baby. If you are alone, you should try and attract help or remain on the phone during CPR. You should never leave an unresponsive child or adult alone at any point.